Hi there, I'm Steve Duvall, physical therapist with West Coast Therapy Specialists. Today's training is on dehydration. First of all, we want to define dehydration. Dehydration is the lack of hydration or the lack of water. That's pretty obvious, but we have to go over that for training purposes. When we're talking about dehydration, we all realize that the body has to have water, has to have fluid. We know we're made up mostly of water, but we have to have water for our systems to function the right way. One of the things we're going to go over is the signs and symptoms of dehydration. One of the signs is urine color. It will be dark, and that means it's concentrated. There's not enough fluid in the system, so the urine becomes dark in color. Another sign and symptom is dry skin, dry lips, and you can always go and take a look at someone's skin and do the quick skin turgor test. Pinch softly and lift up. If the skin stays that way, more than likely your resident is dehydrated. One of the other signs that you might see is a change in mental status. Some of your residents who come in and they're usually nice or they're jovial, and I know that all of us have, every one of our residents are like that. However, you might come in one day and they might usually be kind or nice to you, and they're grouchy. They're super grouchy. They might be confused. That could be because there's not enough fluids in their system and their brain's not going to function the right way. Some of the results from being dehydrated, well, one of the biggest ones is having a UTI. UTI is a urinary tract infection, and that's another training for another day, but we want to know that that is one of the results that we have, and you're going to have more frequent UTIs if your resident is dehydrated. So we got to watch for that. Another thing that you're going to see as a result will be falls. Your resident's going to be more likely to fall if they're dehydrated. One of the things that happens is when you're dehydrated, your blood pressure lowers. When they go to change positions from sitting to standing, something happens called orthostatic hypotension. And that means that as you go to stand up, your blood pressure is low, so it doesn't have the pressure to get the blood to your brain, and you can quickly drop. Another one of the signs is instability, having weakness in your muscles. Again, your muscles have to have water to work the right way. One of the bad signs too, and results that we get from dehydration is constipation. That is a very serious issue, especially in the elderly. So we have to watch for that as well. Not a fun situation. One of the big things we can do is we can prevent dehydration. Dehydration is very, very preventable. What do? You push fluids, okay? We have the cups. We make sure that every resident has a cup in their room, by their bed, with a straw, if they prefer having a straw. But make sure if you walk by a room, you see a cup in there. If it is less than half full, go in there and fill it up. Here's one of the things though, not everybody likes just the taste of water. So know your resident, know what they like. If they like flavored water, if they like the little squirts that drops that you put in water to change the flavor, that's fine. If they like it room temperature, if they like it cooler, whatever it is, you find out your resident's preference so that they are going to be more likely to stay hydrated and drink the water that you have there in the room for them. Another one is that we can use foods such as fruits that have water in there. Certain melons, obviously watermelon is a good one. We can use either fluids or fruits. Another thing too you want to know about fluids, Cokes, teas, darker fluids are ones that are diuretics, and they actually pull water out of the system. So we don't want to push coffees, teas. I understand your residents going to want their coffee in the morning, they're going to want a tea with lunch, but if they do, make sure that they have plenty of water to go with that as well, because you can actually do more harm than good pushing those fluids that have diuretics in them. Finally, one of the best preventions is fully know your resident. Sometimes they like to drink, some of them don't. And every 2 to 3 hours, you want to make sure that you're checking on them, okay? Especially your residents that are on a memory unit or have some memory issues or dementia. Make sure that you're going and reminding them, prompting them to take in these fluids. If we can do these things, we can keep our residents in place, keep them from falling, keep them from getting sick due to urinary tract infections, and we can prevent them from going out to the hospital, and you also prevent them from getting grouchy with you, okay? So that's basically what we have on dehydration. We can definitely, meet with you individually and talk about ways to customize a hydration program for a resident who is very tough to get to take on fluids. Again, some of your memory residents are going to be tougher to get them to stay hydrated. One of the things it does is it increases their urination, and if they're unstable to start with, they don't want to get up and go because they know that they're going to fall. So we can work to customize a hydration program for your resident if their resident is very difficult to keep hydrated. So we have a 3-question test. I'm going to give you the questions. We have a handout, and you can answer the questions and then hand it back in. First question, true or false? Increased confusion is a sign of dehydration. Second question, can increased weakness be a result of dehydration? Question number 3, give 2 ways of determining if a resident is dehydrated. There are several. Just give us 2 reasons or 2 ways of determining if a resident is dehydrated. I hope you do well on your test, and thank you for watching this video.